Hare Krishna, Sadhu Pradam, a very warm welcome to the day 32 of my YouTube channel, Dental Tips. Today's topic of discussion. Today we are going to discuss about pulpectomy procedure in deciduous mandibular second molar, tooth number 75 according to FDI tooth numbering system using this baby blue pediatric rotary file system. So the case scenario is that a child patient comes to the dentist and complains of severe pain in that particular tooth, 7-5 deciduous mandibular second molar, and other complaints are difficulty in chewing and eating the food, and sensitivity to hot and cold, food and beverages, and there is a foul taste in the mouth, metallic taste, and there is a foul smell coming from the mouth. So when the dentist does the intraoral examination, the dentist finds that that particular teeth is grossly decayed. So there is a requirement for pulpectomy in order to save the tooth, until the permanent successor erupts. So the pulpectomy procedure has 3 steps: excess preparation, biomechanical or chemomechanical preparation, and obturation. So first and foremost thing the dentist does, he will isolate the required tooth, and with a rubber dam will give the inferior alveolar nerve block, since the tooth involved is deciduous mandibular second molar. Inferior alveolar nerve block, and thereafter the dentist is going to start with the first process, that is excess preparation. Round burr is taken, long round burr, and it is placed in the center of the affected tooth, and the carious portion is removed. From the center, the dentist moves sidewards and continues preparing the excess until a drop in the burr is felt. And the moment the drop in the burr is felt, the dentist is going to remove the roof of the pulp chamber, remove the pulp, extirpate the pulp from the pulp chamber and pulp canal via barb broach. Thereafter, the dentist is going to locate the 3 canals which are in deciduous mandibular second molar. The 3 canals are mesiobuccal, mesiolingual, and a long distal canal. After locating these canals, the dentist is going to place the files in the 3 canals and take the working length X-ray. Now, after taking the working length X-ray, we come to the second step, that is biomechanical preparation, chemomechanical preparation, also known as BMP. Here, apart from canal preparation, dentist is going to use various chemical irrigants like sodium hypochlorite, chlorhexidine, and normal saline, and 1% is used. And after this chemomechanical preparation with the 15 number K file up to the working length found by the X-ray, after that the dentist is going to take this baby blue pediatric rotary file system and is going to take out the poster file from it. Now this poster file, it has a triangular cross section and it has a variable taper, and the purpose of this poster file is the glide path preparation and orifice opening. So the dentist is going to open the orifice further and prepare the glide path, and after this step is completed, the dentist is going to take the B1 file from this baby blue pediatric rotary file system. The file B1, it has a S-shaped cross section, and the taper is 5% taper and S-shaped cross section. Now this file B1 is for canal centricity and cleansing the canals, further canal preparation and canal centricity. So after further preparing the canal and establishing canal centricity, the dentist is now going to proceed to the third step of this pulpectomy, and the third step is obturation. So what is obturation? In obturation, we are going to place a obturating material, restorative material in the canals. So since it is a deciduous tooth, we will not use gutta parcha because it is going to be replaced. Ultimately, the deciduous tooth is to be replaced by the permanent successor. It will be resorbed. So we place a resorbable obturating material, and the various resorbable obturating materials used in this case could be zinc oxide eugenol, we could use calcium hydroxide, we could use iodoform, or we could use a combination of calcium hydroxide and iodoform paste, which comes in the market by various trade names like Vitapex and Metapex. So we are going to use these obturating materials, and any one of these obturating materials, and after that we are going to put a post-obturating restorative material. Now what is the post-obturating restorative material we use in this particular case? We can use Activa Kids bioactive restorative material. So that is one of the post-obturating restorative material, Activa Kids bioactive restorative material. So after placing that, we are going to do the finishing part, and we do the finishing part with a we use composite finishing burr. We do that finishing with the composite finishing burr, and thereafter we place a crown. It could be a stainless steel crown, it could be zirconia. So that's all. With this I end my today's topic. Thank you many folks for watching my YouTube channel. Jai Shri Krishna. Radhe Radhe.